So here we go. We're going to do episode 3 today. And the first 2 podcasts focus more on kind of our journey of opening our practice and a lot of kind of the business and operational aspects of being able to open a practice. Mm-hmm. So I think if anyone has further questions on that, anyone's looking to really serve people by opening a practice, they can definitely reach out to us and we'd be happy to answer those questions. But sure. I think we're going to try and switch gears a little bit.
Yeah. Let's take it back to basics.
Yeah. I think this past week was a little rough for us. It was a tough week. That's part of any, job or career. And it really put into perspective, a lot of things and really made me focus again on like why we do what we do. And it was a good reminder of the reason that we, put all this effort into our practice and into this podcast and our social media is to help people with hair loss. So I kind of wanted to bring it back to that this week.
Let's educate.
What we were thinking to do is just basically go through tips or things that we wish we would have known as individuals with hair loss. So if you don't know, both of us do have hair loss and have a family history of hair loss. Right. So we can maybe go into that at the end if we want to.
Yeah, totally.
But I think let's start with like tips or things that we wish we would have known or that we want people with hair loss to know.
Right.
Number 1 would definitely be not delaying getting checked out and started on treatment. So I think sometimes there's a lot of emotion attached with hair loss. And for a lot of people, I think that's part of the reason why they delay going in, because it's such an emotional aspect. It's kind of vulnerable in a way, which is totally understandable. I just hate to see cases where people waited a really long time, even though they knew there was something going on, because for most types of hair loss, including like patterned hair loss, which is the most common, and scarring types of hair loss, which are more rare but increasingly common, the longer you wait, the harder it becomes to treat.
Yeah, totally. I think part of the journey is identifying what's going on. And the sooner you can identify, then you can come to kind of a conclusion of, hey, is there something I can do about it? Our job, when we have patients come into our Root Hair Institute, is to just focus on education. We do not want it to be a sales pitch. We do not want you to, just take our word for it. But we do want to plant the seed of gaining knowledge about what's out there, what's evidence-based, what can work. But then you got to also determine if that's right for you. I have a lot of patients that come in and they're totally reluctant about taking oral medications. And when you throw in that this may be lifelong, it's daunting, it's scary. And so having that conversation early, I think, empowers patients with hair loss to take control again, right? And that's super important in this process.
Mm-hmm. Yeah, and I think that kind of brings up another point, which I would say would be, the second thing would be make sure that you're going to someone experienced in treating hair loss. I see a lot of times where people go get checked out, but maybe with someone where that's not their focus and their specialty. Mm-hmm. So I think depending on kind of where you're at and what you're possibly interested in doing, that could mean different things. If you think there's something complex going on, it's not just patterned hair loss, I think seeing a board-certified dermatologist would be a good step. If you feel truly that you just, most likely, obviously you can't know for sure, but that you probably have patterned hair loss and you're really interested in surgery, then I think like a hair restoration surgeon
absolutely.
Would be the way to go.
Right. And it doesn't even have to necessarily, you don't have to seek someone special out so early on either. Like if you have good rapport with your family doc, right? If you have a physician you've been seeing for a long time, chances are they may be able to start you on some of the medications because they've been around for 25 years, these medications. So it's not anything novel. A lot of specialists know about this, and they can at least get the journey started, right?
Right.
And then if you inquire more, you go down the rabbit hole of wanting to learn more, then totally seek out, a specialist.
Yeah, I mean, I do think it is, especially if it's more severe, not just like really early, it still would be good to get in with a specialist.
Totally agree.
Early on, because you might get, primary care doctors are wonderful, but they're dealing with a lot of things and have to know about a lot of things. So
Right.
hair loss may
Right.
not be,
Right.
all the different types of hair loss may not be, super familiar to them, understandably so. But yeah, I think that's an important point of like at least bringing it up with your primary care so they can, maybe check blood work and that kind of thing, get you started on appropriate meds. And they may be able to know like, oh, this feels like there's something major going on. Maybe you should see a dermatologist.
And that's what I'm referring to. We've had a lot of referrals from family physicians with patients who, trust them, of course. They've built good rapport, and they said, hey, this is out of my wheelhouse. You should go see so and so.
Right.
And we've gained a lot of patients that way focused on hair loss and restoration goals. So, yeah, it's just about a conversation, right?
Right.
To spark, hey, this is the education I need to determine what's right for me.
Yeah. But I do think seeing like so number one, like if you're already established with a primary, talking to them about it, you have nothing to lose by talking to them about it. But then also getting in, especially if it's more severe, like with a specialist, like a hair loss center or a dermatologist.
Bottom line, start early.
Start early, exactly.
Okay, perfect. What's the next pearl?
I mean, I would say, what do you think? I think being patient would be another thing, right? I think that's where,
point.
Getting started on treatment, what type of treatment you need is really going to depend on your type of hair loss, your lifestyle, a lot of things. So it's hard to comment on that. But what I would say is whatever treatment plan that you start with, that you're patient with it, because that's where I see a lot of people. They might get started on treatment, but I have so many people where they come back usually after being seen somewhere else. And it's like, well, I started this treatment. And then I ask them, well, how long were you on treatment for? And they say, 2 months, 3 months, 4 months. But most of these hair loss treatments, it can take 6 months to see an effect, sometimes up to a year to see the full effect. So that's where I see a lot of people kind of just give up hope a little bit early.
Right.
So that's something I would say would just be like, be patient with the process.
Right.
I think that's always a good question to ask when you're starting a treatment plan too, is, what are the chances of having results? What are the risks, obviously? What are the alternatives? But then people talk about those three things a lot. But then the other thing I think, especially in hair, because it's such a slow improvement, would be what are the expectations in terms of the timing of results?
Yeah, absolutely. I have had patients that have tried medications and treatments for 2 weeks only and said, hey, it didn't work, And I give them kind of an analogy to compare to. I tell them, hey, it's not like you have a headache and you're taking some, Advil or Tylenol or something like that, and the headache goes away immediately. It is something that's going to be slower, and you're 100% right. You have to have patience in the process, and you have to trust in trying the process, right? And that takes time. It takes a lot of, wanting desire to fix it, but also like you have to be okay with continuing to follow up as well. So I think that's a good segue. It's like you can't just, hey, set it and forget it, because it's such a slow burning process, meaning like whether you reverse the hair loss or let's say you're not actively reversing and it's getting worse, you want to be able to confidently tell, right? So we have patients come back at regular cadence, anywhere from 5 to 7 months after their initial visit, if they're doing conservative things, like medications only, for example. And each visit, we do a round of photos. And that's super important because if you're losing hair, in my experience, you're going to be very, very vigilant. And you're going to know that, hey, I'm losing a lot of hair and I look worse. And it's going to be top of mind. But if you're gaining hair, you're not going to notice that you're gaining hair and you're reversing the hair loss.
Yeah, a lot of times people don't.
Yeah, and that's because you see yourself in the mirror every day, right? So it's not that drastic change where, hey, I haven't seen myself in five months and now I have hair. So those photos that we do are super awesome, right? They really kind of puts things in perspective.
Yeah, no, I think that definitely brings up like the importance of follow-up. When you start a treatment plan, and again, asking in terms of like timing, but also following recommendations of follow-up, and understanding that there's variability in response. So even if you see the best doctors and you start the best treatments, not 100% of treatments are going to work. Like no treatment is going to work for 100% of people, right? There is a degree of variability, but a good doctor is going to have a plan A, B, C, D, E, F, G, A, right? So it's like when they're telling you come back in this amount of time, that you actually follow up and go for a number of reasons. Number one, like you're saying, that's a very common experience for me too. You know, some people do notice, or people around them will have told them, their hairdresser, your hair looks thicker. But you're right, when you see yourself every single day, it's hard to be the one to notice that difference. Versus for us, and especially with the standardized photos and things like that, a lot of times we will see a difference, whereas when the patient comes in, they're like, I don't think I'm better, and then the photos are showing like a huge change. So I think that's an important part of it, following up. And then the other thing I would say with following up, beyond just being able to appreciate change that may not be obvious to you as a patient, would be understanding that a lot of times the treatment plan has to be adjusted. So it's like, okay, I'm better, but I haven't had the improvement to the degree that I want, or it's stable, which is good, because usually over long periods of time, if we do nothing, hair loss tends to get worse. So a lot of times stability is a partial, win, even if it's not the goal. But, if people are not happy with the results, or they're getting worse, not getting the degree of improvement that they want, then it's like, we can make adjustments at that point. But if you give up early and you you come back at 6 months, you're like, I only did treatment for 2 months. That doesn't tell us if that treatment takes 6 months to work. Stopping it early doesn't give us information on how, or your doctor information on how to adjust. And then the other thing is going to be being able to talk through all the other options and where you go from there. So just having, some understanding that even if they're not able to get it the first time, that doesn't mean they're not able to help you. A lot of times it just takes changing the plan, basically. So.
Yeah, like with non-surgical options, and there are plenty, and we can give it a highlight. There are medications, topical and oral. There are injectables, different kinds. There are now, FDA cleared lasers for hair restoration. So the combination of these things can absolutely work in some people, and in others it may not work. And so what I tell patients is, commit to it for a year. If I tell you to commit to something for life, you're going to say, no, there's no way, right? It's just like, all right, I have to do this forever. It's like a daunting task. It's scary. But if you commit to something like 6 months or 12 months and you give it your all, you're leaving no, room for question marks later. And that's very important. So I tell patients, hey, you're going to get a treasure trove of information out of this. And all you'll lose is possibly a little bit of time and effort. Of course, it's an investment, right? Because some of these things cost a little bit of money, but you get so much in return. So I tell them, hey, there's a spectrum of response. You may respond tremendously well. You're going to notice it. You're going to be very happy. And guess what? You probably never need a surgery, which is awesome. Or you don't respond at all, or maybe you don't even like the process, right? You don't like taking the medications. They don't make you feel good. They don't make you feel like yourself. And then that's fine too. You just avoid all of it altogether. And you say, okay, maybe I just embrace, bald. And that's totally fine. Bald is beautiful too. Or somewhere in between. But throughout this, you're basically taking back control. And that's the most important thing to take from this. Because hair loss, like you mentioned earlier, it's very emotional. And you can feel lost and you can feel very alone. But now you've been empowered to take back a little bit of control and kind of make the decision yourself.
Yeah, and I think even if you don't decide to do all the things, at least you have been educated on all of your options.
Yes.
And I don't think you need to try all, you might off the bat know, I don't want to be on oral medications, right? But at least this is the type of hair loss that I have. If appropriate, based on my case, I've had blood work to rule out other things if needed. I know that these are my options. I know that, if I do nothing, this is what things may look like, and then determining kind of what options you are comfortable with, and then seeing what kind of a response you can get from them. And then are there other options that, you become comfortable with over time? Because sometimes I have people where it's like, I don't love the idea of being on oral meds. So, hey, I'm going to start the non-medication based options, but I really care about my hair. So let's give all the non-medication based options a go. Then if I'm not better, now suddenly maybe I feel more okay with the idea of being on an oral med. So there's so many different situations. It's hard to go through them all. But what I would say is that having that education and knowing your options is extremely important. So I do think, again, that's where it's worth seeing someone if you have decided that your hair loss is something that you want to do something about. And if it doesn't bother you, then that's, as you said, okay too. But if it is something you are going to feel better about by being proactive or taking action on, then knowledge is only, power basically in that.
I agree.
And yeah, I think, do you have any other like medical kind of tips for people with hair loss?
Not necessarily. I mean, I think this is great as far as like starting early, right? For medical or possible medical interventions, definitely education. But a lot of times folks are wondering, well, when should I contemplate surgery, right? And I think that's what we should dive into a little bit too. So, I mean, what are your thoughts?
Yeah, I mean, we can go through some different scenarios. Obviously, there's a lot of nuance in different cases, but I think if you have tried non-surgical things, and it's a complicated question because like if you've tried non-surgical things and let's say you're stable, but you haven't gotten the level of improvement, and the improvement that you want is realistic for your case and your age, then surgery can make sense. If, let's say you're older, age also plays into this, right? Because if you're younger and the hair loss is presenting at a younger age, there's less known about what your hair loss is gonna do as you get into like your 60s, 70s, 80s, versus if you're in your 70s, that's a different situation, right? So there's a lot of different things to factor. But like, let's say you are kind of older, and your hair loss has only progressed to a certain stage. In some of those cases, it may be more appropriate to just do surgery alone without medications versus like in a 20-year-old, that's not a reasonable long-term plan in most cases. Again, I think like people who've tried meds and not gotten the level of improvement that they want but are at least stable, that's a good scenario. Older individuals, or maybe they don't have a progressive type of hair loss. So everything we're kind of talking about in terms of like maintenance treatments to decrease progression of hair loss, try to thicken the existing hair, and in some cases grow more hair, all those non-surgical therapies we're talking about tend to apply for like progressive types of hair loss, like patterned hair loss, which is the most common type by far.
By patterned hair loss, we're talking about androgenetic alopecia, male patterned hair loss, female patterned hair loss. And the assumptions we're kind of predetermining on these patients that are possible candidates for surgery is that they don't have a different type of alopecia, like a scarring type alopecia. So that is very, very important too, right? So diagnosis, correct diagnosis rather, of the condition that then possibly makes you a good candidate, that should be done first. Right? And you can't self-diagnose for that, and you should go to someone that actually knows what they're doing and is credible, because the last thing you want to do is undergo surgery and you're not a good candidate, and then you're going to have a failed hair transplant. But you're right. Stabilization in consideration with age is very important. So generally speaking, I agree. I think when I have 20-year-olds, early 20, I say, hey, we shouldn't do surgery. You're so young. Your hair loss can keep progressing. Let's just focus on stabilization. Once you're stabilized, then we'll have the conversation. We may not move forward, but at least, again, you are empowered now to make that decision, right? Now, when you get into your late 20s, 30s, we are a little bit more open to surgery, depending on where your hair loss is. I probably wouldn't touch it if it's in the crown region or the vertex scalp.
Right. Or like lower your hairline super aggressively to where we're using all your grafts and now you have nothing left in case your hair loss progresses.
And then as you get a little bit older, maybe that cost benefit ratio between being on medications and the effect of maintenance or the results from the medications may not be as significant or as important to you because you don't want to deal with side effects or you're already on a lot of medications, right? And then we can just fast track to surgery if appropriate. So bottom line is at Root Hair Institute, at least, we focus on comprehensive plans, right? And comprehensive plans should be focused on decades of hair restoration longevity, right? Not just 5 years.
Exactly. And I think that would be like a tip for people considering surgery is to find someone who doesn't just care about doing the biggest surgery right now and you know maybe they have good intentions, right? And they want to get you a great result in a year.
Right.
But you know, most people are going to be living much longer than that.
Right.
So you need to find someone that's also thinking about like 5 years from now, 10 years from now, 20 years from now, and that the plan that you're doing surgically is appropriate for that. So I think that's a good question to ask is like, how does this work with how my hair loss may progress, right? Do I need to be on maintenance therapies? And honestly, the doctor you're consulting with should be bringing a lot of those things up. I think if they're not, then to me, at least as a patient, that would be something I would be kind of concerned about. Like, why are they not bringing up the long-term plan for me? Why are they not bringing up ways? Because surgery does not. I think that's a good thing to make sure everyone understands that surgery does not decrease further hair loss progression. It does not thicken existing hair. It does not grow more hair.
Your existing hair on your scalp, you are still subject to losing. Right.
It's just taking hair from one area where it tends to be thicker in the back and the sides and moving it to the areas with thinning, right? So that's, I think, an important thing to understand and to make sure that that's a part of your treatment plan. Not just like, okay, we're going to take this hair, it's going to look great in a year, but like, what about like 10 years from now, 20 years from now? And I think, especially if you have like progressive forms of hair loss, like patterned hair loss, you have to be thinking about that.
Totally. And kind of the knowledge pearl I want to drop for some of our viewers that are looking for surgery and they're looking at overseas options because price is absolutely a consideration and it should be. These are the questions you should be asking those surgeons as well. There are a lot of good surgeons worldwide. I'm not going to say any blanket statements because they're not true. However, whoever is doing your procedure, you should be very, very confident they know what they're doing. Have good rapport with whoever's doing the surgery, and the team, as well as the long-term plan. So a 20-year-old surgery plan will be very different than a 40-year-old surgery plan, which will be very different than a 60-year-old surgery plan. And you should be very confident and take into account your age and the degree of hair loss you have and kind of the longevity you want from it. Because you can have all the money in the world, you can have all the time in the world, right, to do repeated procedures, but you only have a finite amount of hair follicles. And that's super important because once a hair follicle is removed from back here with whatever technique that's used, it will no longer grow there, right? So you only have a limited amount that you can safely take before you're causing damage. So it's very important to take that into account.
Yeah, and how much hair you're going to have left over for future procedures. So yeah, you want to make sure that whoever you're seeing has a good long-term plan for you. So I think that's kind of the takeaway there.
Yeah.
Do you have like any particular cases that stand out?
A lot. I like to start with like a little bit of history, right? So back in the day when hair transplant came out, it was actually stumbled upon by physicians overseas where post-war veterans that had scarring type of hair loss, they had hair removed from the back and the sides and placed in areas where there was damage and that hair loss was due to a scar there. And it worked. And the system evolved and continued to improve until we get to, let's say, hair plugs were done. And so what are plugs? You were getting 4 millimeter punches from the back of the scalp removed in rows, and then they were replaced on top. And you had to do multiple procedures for it to look very normal.
So this is, I think, what people think of a lot of times too. If they don't know how great
Right.
modern hair transplants are, they're thinking of like those older cases
Right.
from back then and
Yeah.
how unnatural it
Right.
looks.
So then this evolved into follicular unit transplant or follicular unit strip surgery, where you take a strip of the scalp, right, from the back and the sides of the scalp, and then you stitch it closed. And then when you take that strip, you slice it into hair follicles. So those hair follicles are now units, right? And they can be a single hair.
Yeah, so
two
not
hair.
necessarily individual like hairs, but like individual hair units, follicular units.
Follicular
basically.
units.
So the natural groupings of the hair.
Right. So if you ever hear about the term in your kind of studies about hair transplant of grafts and follicular units, they're pretty much interchangeable. But a graft or a follicular unit can have 1 hair, 2 hairs, 3 hairs, 4 hairs. Like it can be a multi-follicular unit kind of graft. And those are then placed, one by one. So it looks very, very natural. It heals very natural. And even up close, when done appropriately, it looks awesome, right? Natural. However, it leaves a linear scar. So the problem was, as surgeons became a little bit more aggressive, let's say, and started treating bigger cases, right? More hair loss on the same patient, they tried to push the envelope and get more and more and more skin. So if you do that, the remaining scalp has to come together, and so you have a thicker scar, right? Stretch scar. So unfortunately, if you look on Google or you search the interweb for photos, you're going to get the worst kind of photos of this. And then when FUE came out, which is follicular unit excision or extraction, that basically changed the game. And it utilized the old strategy, which is taking punches of hair, but instead of 4 millimeters, it was basically reducing it to 1 millimeter or less, right? So you can take a follicular unit or a graft one at a time. And so you don't have a linear scar, but you have little pinpoint scars, right? And in most cases, it heals so well, the surrounding hairs will camouflage all that area. But then again, when cases became a little bit more aggressive and you start taking too much, 20 years down the road, some of those patients may show patchiness or thinning on their donor region. So what we started doing, right, was, okay, well, we'll do FUT or FUE. And we employ that technique about 50-50 in our practice because there should be no one size fits all. We don't do the 4 millimeter plugs. No one does that. It's an antiquated concept within hair restoration surgery. But we do FUT or FUSS, strip surgery, and follicular unit excision extraction quite regularly and equally. But then I think what changed our practice and allowed it to evolve was the 2-day procedure. And so 2-day procedures take into account a larger patient area, right, of hair loss. And then how can we obtain the most hair with the least amount of damage? So safe removal of the hair follicles from the back. And so we do a hybrid option, which is the strip surgery on day 1 and FUE above and below on day 2, and then transplanting them one after another over the 2 days. So you have 2 distinct surgeries in back-to-back days. Or patients that don't want the strip procedure at all, right? For whatever reason, they're scared or they want to wear their hair short. We just do a large FUE procedure on 2 different days.
Yeah, and it's not appropriate for everyone, but it can be a really good option, especially if people are willing to shave down like the donor and everything.
Yeah, recovery one time as opposed to in subsequent years.
Yeah, because it was basically doing like what we used to do, which was like to do a strip and then a year later to bring them back and then do like a lot of times another strip or FUE.
Right.
But just like the discussion in general of like, is a strip procedure, an FUE procedure, a hybrid procedure the best for you? It really depends on your case, but I think it is good to understand the different types of procedures and then to make sure that you understand kind of the advantages, disadvantages, and what's best for your case. And I think that could be like a whole podcast of like the different types of procedures.
Yeah, in the right hands, there's a lot you can do surgically. or have done to you surgically. So understanding the concepts are very important. And then definitely ask for photos. Like even our website, we have a limited number of photos because we take patient privacy to, the extreme.
Yeah, they have to give us
a lot of
consent
right.
in order for us to be able to share. Even though all the photos are de-identified, we
Right.
still allow them to make that call.
But a lot of our patients are open to us sharing it in the office.
In the office,
because they
exactly.
feel that their experience can educate others and kind of propagate, a good line of like, hey, good faith, this person can benefit. Sure, show my de-identified photos.
So there's a lot more available like
Mm-hmm.
in office for consultations that we have permission for than like online.
Right.
But that's a good thing, like in office during your consultations, to make sure you ask for to
Right.
see photos and everything too is a good thing to do.
And I had a recent patient, actually, since we're on the topic. It was a great consult. It was a young patient. They asked, hey, can I get like an AI rendering of what it can look like after? And I said, no, the problem with that is it's going to lead you to think that you're going to have this result and you're going to be stuck on this result. But reality is AI can be manufactured and make you look amazing. But
Right.
hair transplant surgery is limited by the techniques involved, the
Right.
quantities moved, the growth.
Your hair quality.
A lot, right? And if you start on medications now and you hop off of them, let's say during the course of the process, in 5 months, 6 months, then that's going to take into effect, right? Like the results, right? So your results may not be as strong as when we see you in consultation, for example. So there's so many variables that it's going to pigeonhole you into a unrealistic result, which I don't think is fair to the patient.
Yeah,
right?
I think real life examples are much better thing to look at
Right.
than AI. I think there's some companies that have also tried to like pitch that to us of like, oh, show people, and it's just this.
Yeah.
Yeah, it's that. I don't think that's the way. That's not realistic. And part of considering cosmetic surgery is to make sure that you have realistic expectations and you understand, what is doable. Because you can have amazing results, but it needs to be realistic results, not
So going on a tangent of technology, we want to touch upon robotics in hair restoration, because that comes up with a lot of patients, especially in their initial research too.
Robotics is a tool. That's this is what I'll say is just like any other surgeon using any other method, you need to make sure that the surgeon that you're going to is using it as a tool, not solely relying on it, because an experienced surgeon is still better than the robot at this point. But there are good surgeons who use them, but again, it depends on the quality of the surgeon. So that's what I would look at it as, would just be a tool, because there's still limitations on it, and a good surgeon will know when to use it and when not to use it. So that's what I would say. But do you have any other tips for people with hair loss?
As far as
just like in general, we kind of did like, you kind of took it to like surgery. So any other like surgery tips for people considering surgery?
Yeah, I mean, I think it's important to also understand the post-operative phase, what to expect as far as recovery goes. And generally we say, you're going to need 7 to 8 days of relaxation.
Yeah, and I will say you're going to go I don't know that we necessarily need to go through our process because it depends on the methods that are being used and your surgeon. So I don't know that like us going through what we do and how it is with us is the, because that might not apply to the way they're doing it.
Generally speaking, I think any type of surgery will lead to the following. You're going to need at least a week, and in some cases a little bit longer, of avoidance of exercise, things that cause sweating, you want to limit anything that can disrupt the stitches or sutures in the back if you do the strip surgery. FUE scars heal a bit faster, but in both cases, if you're getting a haircut, you want to avoid it for a few weeks, at least until you get clearance from your surgeon or the medical team. Swelling is a big component of the recovery. It pretty much happens.
Especially if you have bigger surgeries.
Especially if you have bigger surgeries, and if you have surgeries along the hairline, because that fluid,
or the eyebrow,
or the fluid and the inflammation that gathers in that postoperatively has to escape, and it will fall with gravity. So it will fall down, down, down. And so sometimes patients will have oblong-shaped heads for a little bit. And despite the counseling, we'll usually get a photo or an email saying, hey, is this totally normal? And we say yes. It's never permanent, which is fine. Sometimes you can have black eyes as that swelling goes away. So these are the things to expect, right?
Yeah, and you want to be aware. Make sure you're like fully aware of what is within reason to be expected, and also what is not expected.
Right.
And that's something your surgeon should go through with you. And a lot of times you'll receive written materials, but you want to follow like the exact instructions and recommendations of your surgeon, just because there are different techniques that are used. And then, I mean, my piece of advice would be, as you're healing, if you're not sure if something is normal, to ask your surgeon. Don't just like, it's better to ask. It takes 2 seconds for, for them to tell you, no, that's fine, that's normal, than to not ask and, it be a sign that something is going on.
Absolutely. As far as growth after surgery, it's going to take some time. It's not going to be immediate. And you can start seeing growth fairly early on. Some patients as soon as 3-4 months after surgery. A lot of patients will show significant growth around 5 to 7 months. And then we generally say final results are around 12 to 18 months. Some people need that long for all of their hairs to grow in. And it is, again, very important to trust the process and, inquire with your surgery team, right? So we have follow-ups built in so that patients aren't looking on Google, okay, well, what happens next? Again, we go through all the photos. So a lot of times folks forget how bald they were or how thin they were. So that's a pleasant surprise to them.
It's fun showing the photos. Definitely.
It's fun. It's really fun.
Getting to show them the improvement and because a lot of times they're not looking at like the top of their head or whatever. So to see like that.
Yeah, absolutely.
Yeah, that's awesome.
And I think, one of the things to understand is if you're going through the process of, hey, am I a good candidate for surgery? Definitely inquire, is the hair type something that surgeon has dealt with, right? If you have straight hair versus if you have curly hair, if you have, dense hair, if you have thick hair, if you have thin hair, what is the best technique? Has a surgeon done some cases like mine so that the expectation can become a little bit more aligned? A lot of times in cosmetic surgery and definitely in hair transplant surgery, you want to make sure that you yourself have a realistic expectation and you're not being led astray, right? So we never do we never do a disservice to the patients by telling them, hey, we're going to make everything look perfect, right? Or, they come in with a photo of like Brad Pitt or George Clooney. And like, yeah, we could do that. No, it's very, very important to individually treat patients, personalized to them based on what tools we have, which is their hair.
Right, exactly.
Perfect.
And then unless you have anything else like major tip-wise, I think my last tip would probably be to know that you're not alone. Because I feel like a lot of times it can feel very like isolating, and I think some men are open about their hair loss, and it's just a little bit, there's still stigma, but it's a little bit more socially acceptable than in women. But I find with my female patients, like women do not talk about their hair loss, right? They will like use any product, any hairstyle to cover it.
Right.
And it's something they want no one to know. They'll go very far lengths to hide. So I think a lot of people don't realize that their friend or family member is also maybe dealing with something similar. So that would be my last thing, is to just know that you're not alone. It's much more common than a lot of people realize. There's a lot of people going through it, and that there's a lot of treatment options and places like RHI that are there to help people and guide people on that journey. So just knowing that you're not stuck with figuring this out on your own, basically.
Excellent.
But I wanted to go through some questions that we got online. And just a reminder, if you do have questions you want us to go over, that you can comment, DM us, follow us on social, and we will try to go through as many of them as we can. So I'll pull those
Yeah, we
out.
like doing that. Education is key.
Obviously, and this will be written in there, a reminder that this is not medical advice. This is general educational information. We don't know your case. We don't know what you have going on, your medical history, all that kind of stuff. So make sure you get checked out and actually speak with a doctor on what to do in your case. But we just want to provide some general education here.
Yeah. So, what age is too early for finasteride to be started? Are early 20s okay?
Yeah, I don't have a cutoff, I would say. I have prescribed even like late teens with
Right. We should say this is for male patients.
Yes.
Right. Yeah, not female patients.
For male patients, I have done as early as late teens with the counseling and consent of, the patient and their parent or guardian. But I don't think early 20s is too early to start necessarily. It depends on how advanced the hair loss is what I would say. Right. But if you're presenting with hair loss that early, to me, if anything, a lot of times that indicates that your hair loss can be really progressive and aggressive. So if anything, a lot of times I am discussing medications more than I would be even at like a later age, because if they really care about their hair and preserving their hair and they're presenting that early with patterned hair loss, a lot of times it may be that they're more likely to progress to really advanced stages. Right. So it can be that much more important to be on as many forms of non-surgical therapy, like medications, as possible.
So going on the finasteride question.
But it would not be approved for minors. It would be off-label for minors. Right. And there's limited studies on that too. So that's something to understand. But I don't think it's absolute no. It's a talk to your doctor. So
subsequent question on this is, do you think the 1 milligram day is too much for people getting started on finasteride? And what dose would you typically start someone at?
As most people not most people, but the person asking this question, I would assume probably knows that the FDA approved dose for finasteride is 1 milligram per day. That is the dose I usually prescribe and start people on. If people are concerned about side effects or have something in their history, like depression, let's say, or something else, then I will consider doing lower dosing. Or a lot of times what I'll do is talk about like topical finasteride as an option, or maybe doing like Monday, Wednesday, Friday, like 3 times a week dutasteride. Mm-hmm. It's still a possibility with those, but sometimes I'll change things up. But again, the only FDA approved way of doing it is finasteride 1 milligram daily. So for most people, that's what I'm starting, but there are select cases where I'll discuss other options like topical finasteride or the dutasteride 3 times a week. I have had a couple people where I've done like finasteride 1 milligram a couple times per week too. Mm-hmm. But what about you? What do you normally do? Dutasteride in those cases, or what?
I like to start with finasteride. If someone is very hesitant, I won't start it. I'll say do more research, right? We can always start it later if we need to, and then we'll do a slow ramp up because I want to feel confident. So with finasteride, the optimal doses, ideally 1 milligram daily, but we'll start on every other day, right? I've had patients that have cut their tablets before too into half dose. Yeah. And it's just a matter of continuously engaging with them. Are you having side effects? The first moment you have a side effect, you get off. The majority of my patients that have ever had a side effect, and they're very rare still, they get off of it and the symptoms resolve, and then we go a different route, right?
And that's totally fine. The scary thing basically are those reports of irreversible side effects like erectile dysfunction. And that's super, super rare, and I think that's a different question.
There's just how common is PFS or post-finasteride syndrome?
Right.
And so I can take that. That's a very controversial topic in and of itself.
We can't tell you absolutely. What we can do is review the data that's out there that you may have seen.
Right.
And you can go through that, but go ahead. Go.
Yeah, 1.8% of patients can have erectile dysfunction.
In one study, they showed.
In one study. Yeah. 1 to 1.5, 1.2 to 1.5% of patients can complain of sexual dysfunction, gynecomastia, depression-like symptoms. But then in other studies, it was shown that, of the people that were counseled on these side effects, 44% of them came down with a possible side effect versus those that were on this medication and not counseled on the side effects, only 15% of them complained of any side effects. So there may be a nocebo effect here where you
Which
know
is like
too much.
It's an opposite of a placebo effect, right? So
Right.
like placebo effect is, we tell you this is going to work. You take something, you think it works, even
It's a
though
sugar pill and,
right.
I'm growing hair.
Right. And then, with that, there's a question of, is some of this because we're counseling people and scaring people? Is at least some, maybe probably not all of it, but is some of it, especially because these are a lot of the side effects like depression, sexual dysfunction, which can be decreased sexual interest, or erectile dysfunction, are very somewhat like subjective experiential things. So is counseling them putting that association in their mind rather than it being something.
And it should be taken into account that age plays a role, right, with sexual dysfunction. So it can be confounded. And stressors can also confound that too.
Yes.
If you have a lot of stress in your life.
But what I like to say is like worst case scenario, let's take the highest numbers so there's different studies. So like we're not going to be able to tell you what it is in reality, right? We can say like this study showed this percent, this study showed that percent. And that's what I tell my patients, right? And I'll say, let's take it as worst case scenario. So let's take the highest number of those studies and say worst case scenario, it's this. And then it's a really individual choice, right? Like some people will be like, yeah, that's fine. I care about my hair. I want it. Let's try it. If I have a side effect, I'm going to stop it. I understand that there's even this low risk of having this permanent side effect, but I want to try it. Yeah. And I understand that most patients, if they stop it, the side effect goes away.
Right. It's very individualistic. So that's the question to ask yourself.
And some patients are like, do not stop talking to me about this. I do not want this. Like, let's talk about anything else. Yeah. So it's hard to say what's right for the person. I think what is important is understanding the data that's out there, being educated on it, and then deciding what's right for you.
Right. Another question is, what have you noticed in long-term finasteride users, those that have been on it for 20 plus years, 25 plus years? Because it is an old medication, right? I think it came out in 1997, 1998. It's all generic now, and a lot of companies offer the same medication that's been there. But I think there have been recent studies, especially out of Japan, I think, that looked at long-term users of finasteride and generally deemed it safe. Any input on any of that?
I don't know the study that you're referencing. I'd have to pull it. But, I mean, generally speaking, most of our patients who've been on it a long time are doing really well. So some of that might be anyone who had side effects didn't decide to continue it long-term, right? But the people that did tolerate it well have done well on it. What I will tell you, I'm not a candidate for finasteride right now, but because sometimes we use it in postmenopausal women, but in premenopausal women, and that would be off-label. But most of the hair surgeons that I know who have hair loss are on finasteride, and they've been on it since it came out.
Right.
So
that they put their children on it early on too.
So, it's generally well tolerated.
Right.
But again, I think the people that are on it long term are probably not the people that had side effects. The people that had side effects came off of it.
Right. Or went to, the internet to post about it. And so take everything with a grain of salt. Bottom line is ask yourself if it's worth it. If it doesn't seem worth it, or you're going to lose sleep over it, don't start it.
Yeah,
it's not
and
the only thing that's available.
The data kind of can be confusing. So what I would do is take the highest percentages, look at it like worst case scenario.
Right.
And then are you okay with that worst case scenario, basically?
So there's a question here on thoughts of topical finasteride having less effect on serum DHT levels while still having a strong effect on scalp DHT levels compared to pills. Would you recommend this topical option over oral?
Yeah, I mean, I still prefer oral in terms of effectiveness in those who are comfortable with it.
Right.
But topical finasteride has a it's still not like as robust of data as oral finasteride, but it has like building evidence. And there's some studies showing it doesn't affect DHT levels. There's some studies showing it does lower DHT levels. So how I normally counsel patients is like, yes, the side effects are not reported, at least that I'd seen in the studies that I'd reviewed with topical finasteride. But because some of the studies did show decreasing DHT, that they should look out for the same side effects.
Right.
And if they had any of the same side effects, to stop it. It's a lot less likely because there's going to be a lot less systemic absorption with topical versus oral. And so, but I do still kind of tell them to look out. Yes, it's less likely, but look out for the side effects. If they had it, stop it. And then same like warnings in terms of not using it in someone trying to conceive, or making sure that someone who could be pregnant's not exposed to it would apply. So like I would not have someone who could be like pregnant, like applying the topical for you or something. Right. So those same kind of warnings.
Right.
Just
or
to
even
be safe.
handling the oral medication.
Right.
So then that leads to the next question. How do you feel about medication-less transplants for those who absolutely cannot tolerate either medication or they don't want to be on it?
So I think this kind of goes back, we were talking kind of about like surgical candidacy, kind of a similar thing where you have to factor in like age. Mm-hmm. Like if it's like a 70-year-old, 75-year-old versus like a 20-year-old, that's a very different conversation. Right. A 20-year-old doesn't want to take meds, and I don't know if their hair loss is stable and they just want to do surgery and they have patterned hair loss, which is likely to be progressive. I probably, unless it's some weird scenario, wouldn't recommend that. Right. It's a 20-year-old, but they have like a scar from trauma and they have no evidence of hair loss. Okay, depending on the size and how much of their donor it's going to take, maybe that's appropriate, right? Right. But yeah, I think you have to factor in like what type of hair loss is it? Is it progressive? Family history can be a good indicator. It's not perfect, but it can give us some information. Age, and then I want to know like if they're on non-surgical therapy. So you're not on meds, okay, but are you on like injections? Are you on red light? Did that work for you? Right. So there's a lot of other information I would want to know, and ideally would want to be somewhat comfortable that they're somewhat stable if it's a progressive form of hair loss, or that the surgical plan is appropriate. There's a lot of things to consider. Yeah, because it's like also like what are you trying to do with surgery, right? Like are you trying to like lower your hairline aggressively and then it's going to look really unnatural? Right. Or you just want to like fill in here and you're okay if down the line you lose all this hair, that you still kind of have some feathered hair through here and the front strong and you're okay with it. It depends on the case.
Right, absolutely. And I would just add to it, depending on the size of the procedure, you should determine with your prospective surgeon how much of the donor they're going to use and how much will you have left over, right? So you want to always have a rainy day fund. If you lose more hair, you want to have the ability to go back and correct it. You don't want to deplete all of that donor region in one fell swoop, because then your future self may not be so satisfied. Okay, so then the final question is, does microneedling affect hair transplant viability?
So microneedling, if done appropriately, I don't see why it would. But microneedling can cause issues if it's done too aggressively with like scarring. So I think if you were using it too aggressively and causing damage and scarring, then that could cause an issue, because anytime we try to you could be, number one, damaging your hair follicles unintentionally, and so obviously that's going to have an impact. Number two, if you're creating a bunch of scar tissue, then sometimes the tissue is different, there's less blood flow, and so it cannot support transplanted hair as well. Right. But that would be kind of, that's not super common, right. But it's something to be cautious of and aware of. But generally speaking, if you're doing it in a safe, not too aggressive way where you're not causing damage to hair follicles and not causing scarring, then I don't see that being an issue.
Well, that's excellent. So I think we went through a lot of information. To recap.
Yes, and I do want to again say we tried to answer the questions, but again, like, we don't know your case, we don't know your situation, and even like the discussion about finasteride, and that you want to have that conversation with your doctor. You want to talk through
Right.
the risks, their experience with it, and then ultimately make the decision that's best for you. But again, this is, us trying to educate, but it does not substitute going to your doctor and getting checked out and having those conversations.
So to quickly recap, start early, okay? As soon as you want to start it. Earlier possibly gives you the control earlier on to make the right decisions for yourself. There are a lot of treatment options out there. They should be combined. They don't have to be. There's no one-size-fits-all approach. And then you can use both medical and surgical interventions, and that should be discussed with your surgeon as to what they recommend and what fits well with you, right?
Yeah, be patient.
And then be patient.
Follow up.
And you are not alone.
And you're not alone.
You're not alone.
And we maybe missed one, but I think that was most of it.
Okay, perfect. So that ends podcast episode number 3. Can't wait to see you guys next time for number 4.
Let us know if you have more questions.
Absolutely. We love doing this.
Follow and subscribe.
All right.